In the 21st century, as we moved into the 2000 time frame, the VA shifted gears and started to focus on the veterans themselves, on the patients. And while we continually strive to upgrade the infrastructure and the technologies that we're using, one of the greatest advances that we started was the My Healthy Vet program, the Veterans Personal Health Record System, where CPRS, the Computerized Patient Record System, is extremely useful to the physicians and employees of the VA. It's the personal health record system that takes that same data, reformats it, and puts it into usable form for the veterans that has occurred, and the system is still evolving, but that work started in the early 2000s and continues to move forward. We also put in place during the 2000 time frame a number of other innovations. The VA collaborated with the Department of Defense and built a system now referred to as the Federal Health Information Exchange, and this allowed us to connect the VA and the Department of Defense electronic medical record systems together, so that when a military person moved on and became a veteran, left the military and became a veteran, we were able to move the data from the automated systems over into the Department of Defense and bring their data over into the VA, and that way we could have continuity of care and we could start to maintain a long-range, sort of a lifelong forerunner to a lifelong medical record on our customers, on our patients. We also did a lot of other things in this first decade. We put in place a master patient index. We did major advances in terms of infrastructure, but we also started collaborating with other organizations. Prior to this time, the VA spent a lot of time focused on itself, but as we moved into this 21st century, we also realized we needed to exchange data not just with the Department of Defense, but we needed to help the country move forward in putting in place electronic health records everywhere. So the VA got involved with national standards organizations and helped create a lot of the health information standards that are used today. And you can see on the slide above, in front of you, that we not only moved heavily into the standards area, but we also started sharing what we had developed over the years, our electronic health record technology, our personal health record technology, our health information exchange technology, with other agencies and with the public and private sector. And I think what we've done is we have started in this decade to truly impact healthcare, not just within the VA, but across the country and outside the VA. At this point, we're in the presentation, we're pretty much talking about today, the time frame we're in 2010. The VA's going to continue to move forward in time, going to continue to enhance our systems, going to continue to improve the architecture, is going to continue to find new applications, and we're going to modernize old systems or old components and bring them up to date. We're going to find a never-ending slew of new things that are going to be happening. Think of what's occurring out there in the world. Personal health records on the web. What you're seeing on the screen in front of you is a screenshot of My Healthy Vet and the web-based electronic or personal health record that's available to our veterans.